Eggs or coffee and everything. If not, you know where to get them. So we're excited to have you here, delighted to have all of you who responded to our invitation to be here. And I believe we have representatives from all the 7 committees that we've invited. It's been, I think, a few years since we've had one of our annual programs. Dr. Sylvia and I were talking about that. The last time we had a program update at the Chop House in Pasadena, an evening event. But as far as an actual morning event, a full program, a half-day program, so we're happy that you're here. There are some members of the committees that you may not have met before, may not know who we are. So I'm Randy Henderson. I'm the director of our Transfusion-free Surgery Patient Blood Management Program. Alex Perez, you've met him. Alex is our coordinator for the program. And of course, we have 4 of our physicians who will be speaking. So first up, I'm pleased to introduce Dr. Stephanie Hall. And Dr. Stephanie Hall, she's our Chief Medical Officer here at Keck Medicine of USC. She's also Associate Dean for Clinical Affairs with the Keck School of Medicine. She's also the person I report to here. And I have been for the past couple of years, so hopefully I do a good job. She's also someone who provides clinical oversight for the various initiatives here, active role. She has an active role in delivery of safe, quality, efficient care to our patients. Very important. She represents the faculty physicians too. So I introduce Dr. Stephanie Hall.
Thank you, Randy. It's been fun. But it's nice to have rain in California, right? So I just wanted to say a few words about myself and how I came to be in this position. My background is actually in emergency medicine, and I've been faculty with the university for going on 25 years now. And in my career, I unexpectedly found myself involved with quality, safety, risk management. And as faculty in emergency medicine, as many of you might know, here at Keck, at our hospital here, we do not have an emergency department. And so people often ask me, well, what are you doing at Keck Medical Center? Well, at Keck we have more than one facility, and my training and practice is primarily at the county. And so I served as Chief Medical Officer for 13 years at LA County, USC. And then just about 4.5 years ago, I was recruited to come here at Keck Medical Center. And it's been a wonderful experience. And part of my role, really, is to focus on patient safety, quality, ensuring that the patient experience is what we would expect, and that we deliver on our commitment on providing beyond exceptional care. I'm very proud to work with this incredibly talented group of physicians here. We have quite a number of physicians, and what I thought I would do for you today is just to give you an overview, kind of tell you about us and who we are, the services we offer, and what our philosophies in practice are. So first of all, you're going to probably hear, a lot of different references about Keck Medicine. So what is Keck Medicine? Keck Medicine refers to all of our healthcare entity, and it is a widespread entity. It's not just here on this campus. We have a footprint across the Southland. And the campus that we're here in today is referred to Keck Medical Center. And the Keck Medical Center includes both our Norris Cancer Hospital, which is located just right across the street, and here, the Keck Hospital. But we also have another hospital, our affiliated hospital, which is Verdugo Hills Hospital. It's located just a little bit north of here, about 14 miles up the 2 freeway. And that hospital is a community hospital that we acquired about 6 years ago, and provides an opportunity to expand our practice in different venues in the community. So without further ado, we'll just go and take a look at this map is actually every day. I could update the map. Every day we have new clinics, new sites of services. And so we have not only, as I mentioned, the 3 hospitals, but we have clinics that represent our USC Care Medical Group, or our physicians practice, in Orange County, Fullerton, Brea. We have presence up in Bakersfield, that's far north is Bakersfield, and throughout Southern California. And so that's just to give you that we provide access to patients all over Southern California. Over the years, the Keck Medicine name and our brand has become one of the nation's most respected academic medical centers. And we're fairly new. The university acquired the hospital only about 9 years ago. And so with regard to academic medical centers, we're newer. Although many of you, and I've talked to some of you in the audience that remember the university hospital opening in 1991. And that was a joint venture between the university and Tenet Healthcare. But the university became full owner of the facility and all of the Keck Medicine just a short 9 years ago. We have a comprehensive approach to providing healthcare and medical care, and we provide all specialty services within medicine. One of our goals is to always provide an individualized care and making sure that we're working closely in collaboration with our community to ensure that the outcomes are what our patients expect and desire as far as our mission. This mission was developed at the time by the employees and the medical staff about 9 years ago, and it basically tries to encompass what our philosophy is, and that we strive to always be the trusted leader in quality healthcare. That's personalized, compassionate, and innovative. And that kind of represents that not only are we providing standard of care, but we push the envelope to be innovative and provide the latest resources and technology that is available. We stand for empowerment, integrity, respect, collegiality, and vitality. And we commit to authenticity. We commit to excellence in clinical care, teaching, and research. And you can count on us to be fully present in the delivery of uncompromising healthcare. And so we strive to embody this philosophy, and we hope that all of our employees are always striving toward that, and all of them participate in working to not only orient them to this philosophy, but that they live it on a daily basis. So a little bit about the Keck Hospital. It's a private acute care hospital that's staffed by only the faculty of Keck Medical Center. We have a closed medical staff on this campus. We have a closed medical staff at Norris Cancer Hospital. And that means that only the faculty members that have been vetted through the university and our strict standards are given privileges to practice. And we have some of the most advanced technologically available equipment here on this campus. A little bit about just some demographics. Our average daily census is running a little bit higher this year, but this was from the 2017 data set. We have 400 beds. We have 84 intensive care beds. Each of our intensive care beds are specialized. For example, we have neurocritical care. We have surgical intensive care, and our surgical intensive care units are broken up between different types of surgical, so it's even a sub-specialized, so that the nursing staff and the physicians can count on collaboration and expertise in their specialties. We have also an acute rehab unit, and then our general surgical medical care units. Our medical staff, we have over 900 active medical staff, and 500 and almost 600 full-time attending. And this number on our employees, we are closer to 3,500 employees. We do quite a number of surgeries, and this number continues to grow. I think our inpatient surgeries have now topped out at 10,000 per year, and our inpatient admissions, we can talk a little bit about that, about 18,000 this for 2018. A little word about case mix index. One of the things that case mix index, for those of you who are not familiar with that term, is a representation of the acuity of a patient when they come in. And this is an average calculation that's used in the industry. And here at Keck Medical Center, because we are a tertiary quaternary referral center, and we see about 25 to 30% of all of our admissions through a transfer arrangement from another hospital. And that means that we are accepting those patients where a community facility may not have the expertise or capability of managing these complex care. So that is our area of business. And so our average case mix index has actually reached 3.0, which is very high. The average in the community is about 1. In our ICUs, our case mix index is up to 8 and 9, which is extremely high. And it just reflects the fact that our physicians, our nurses are capable of handling the most complex and most difficult patients where otherwise you might not be able to receive that care. I also want to say one thing about our nursing. Here at this medical center in the state of California, you may be aware that we have nursing staff ratios, which says that in a regular medical or surgical bed, your staffing ratios are expected to be at a minimum 1 nurse to 5 patients. Here at Keck Medical Center, our ratios at a minimum are 1 to 4, but frequently 1 to 1, and sometimes 2 to 1 in our ICU. Furthermore, we are pursuing the magnet designation, and we just had our visit for magnet. Magnet designation talks about the commitment of excellence in nursing. Only 10% of hospitals in the United States are magnet designated, and our survey was very successful, and we're waiting to hear our designation status in July, so we're hopeful that that will be positive. Just to achieve magnet status, it's a 5-year journey, and that's about nursing education, ensuring that our nursing staff have the highest level of education. A high percentage of our nurses are at master's level trained, and many are PhD or doctorate level. Some of the recognitions were recognized by U.S. News and World Reports in many of our specialty areas that include not only ophthalmology, urology, cancer, geriatric medicine, nephrology, cardiology, heart surgery, and neurosurgery, diabetes, across the board. We were also given an award by Vizient, which is a industry consortium that works with academic medical centers to benchmark and collect data for the purposes of quality improvement. And our improvements in quality were recognized by the Vizient program. The next thing I'd like to share with you is our Vizient, or our CMS star rating. We've got this back here. I did not update this one because this is a preliminary. 2 weeks ago, we received a notice from our CMS that our star rating, which the quality star rating is a measure that is put out by the Centers for Medicare and Medicaid to help consumers select best medical centers for care. And it is based on 64 measures of quality, safety, and patient satisfaction. Most hospitals range in the 2 or 3 star range, and we just were notified that our star rating has been upgraded to a 4-star rating. And it's based on primarily the advancements in our quality performance over the past year. Some other things that we are, and medicine is highly regulated, as I'm sure you know, and we are certified and accredited by many, many agencies. Here's a list here. I can tell you that any week of the year, we have some agency on our campus to ensure that we're meeting not only standard, but in our role is to always exceed standards. So we are Joint Commission accredited. We're accredited by the American College of Radiology, the American Association of Blood Banks. The United States Environmental Protection Agency ensures that all of our safety standards are in place. And I could go on. This is just a brief summary of all of our accreditations that are mainly good standing. Now, I know this is an eye chart, so I'll be asking you to fill out the exam at the end of the day. This is really my purpose in sharing this particular list is payers in healthcare look for hospitals that achieve certain level of quality. And by participating in a Center of Excellence program, basically payers ask us to provide data, quality data to them, and if we meet certain standards, then they would designate the facility as a Center of Excellence based on specific disease entities or programs. And these are a current list of all of our Centers of Excellence designations. And they encompass nearly every area of medical practice. Next, I'd like to say a few words about our Norris Cancer Hospital. Norris Cancer Hospital is one of 11 NCI-designated cancer centers in the country. An NCI-designated cancer center is one that has been designated by the federal government as not only providing high-level cancer care, but combined with a research and offering clinical trials to those patients with complex cancer or cancers that are deemed not, that the community is beyond a community practice. And so our cancer hospital is dedicated entirely to the treatment of all types of cancer. The hospital is a 60-bed facility, but most of the care that we provide our patients is really provided on an outpatient basis because the advancements in cancer have eliminated the need most often to keep patients from having to stay in the hospital during their treatment phases. We're also one of the 8 designated comprehensive cancer centers for research by the National Cancer Institute. And the philosophy and our goal that was set forth by the donor, who is Kenneth Norris Jr. and his family, that provided the funding in order to build and open the Norris Hospital, and the family continues to support the mission, and that is to make cancer a disease of the past by advancing and integrating research, education, and personalized patient care. We have 60 beds. We also offer a bone marrow transplant unit. And our average daily census is about 35 right now, and we have over 100,000 visits annually, and that continues to grow because we just opened a new Norris Cancer Tower for the ambulatory services and infusion services, which is located just feet from this building to the right. And that new tower provides additional resources for our patients in the state-of-the-art. Our medical staff at Norris is about 800 with over 500 full-time. Norris is recognized by U.S. News and World Reports as a top cancer facility and is accredited by the American College of Radiology for radiation therapy. We're also FACT certified, which is the certification for bone marrow transplant, which is a very difficult certification to achieve, and requires excellent outcomes in all of the patients. So again, we're also certified by the Joint Commission and the Commission on Cancer, comprehensive. C4QI is a coalition of cancer hospitals, and that is dedicated to ensuring the quality of care. And then finally, our Verdugo Hills campus, which is in Glendale, right up there, near the La Cañada, Glendale, and Montrose, where they all come together. And it's a 158-bed hospital, community hospital, that provides services that have a very busy emergency department. We provide OB and pediatrics there, and have just in January opened a level 2 neonatal intensive care. Our physicians do practice there, but unlike the campus here, it's an open medical staff model. So not only do our private practice physicians who have their own practice, they do staff the hospital, but our faculty do as well. So it's a mixed model. Our average daily census there is about 85. We have 400 medical staff members, and our average case mix index is on the lower side because it's dedicated to the lower acuity services. The Verdugo Hills is accredited by the DNV, which is an alternate accrediting agency, a competitor of the Joint Commission, if you will. We're also a certified stroke center, and just recently underwent a certification for hip and knee joint replacement. We have a very robust program there, and we are waiting to hear back on our certification status. We're also accredited by the American College of Radiology. Our emergency department is approved for pediatrics, and we also run a transitional care unit, and that is for a lower level of care. And that transitional care unit has received a 5-star rating from the Centers for Medicaid and Medicare. And then we have multiple distinctions. So in summary, these are some of the services that we provide. Everything from organ transplant, cardiovascular surgery, cardiothoracic, minimally invasive procedures, robotic in nearly all areas, acute rehab, neurosciences, advanced endovascular procedures, vascular, otolaryngology, GYN oncology, etc. So I won't go into all of these. And then finally, just a few words about our services. We have a 24-hour transfer center, and our goal is to ensure that we receive requests for transfer on a timely basis, and that we work very hard to try to transfer patients that request those services as quickly as possible. Hospitals around the Southland are very familiar with our number. Basically, it's USC 1855 USC beds. A phone call. There's an immediate. We also have what we call an aortic program, where patients who have acute aortic disease, a phone call to the aortic disease program will connect you with a physician instantly. And same with our stroke program. And that's called the Rapid Transfer Program, and our ability to move patients very quickly because of the time dependency. We also have managed care services. We have an inpatient hospitalist program that support all of our surgical specialists, and we also offer palliative care programs for those patients who have chronic advanced disease conditions. And finally, our patient and family experience is dedicated to ensure that patients have a good experience, and when we don't live up to expectations, we do our best to make things right and do service recovery. We do welcome rounds. We offer patients resources such as when a family member is in the hospital for prolonged periods, we can arrange for housing across the street at our Stevens Hall. We have a number of apartments available, especially, for example, our bone marrow transplant patients. If their families are traveling from out of town, then we arrange to help them in addition to local hotels, etc. We work very hard to ensure that all of our services, and that we're not only delivering highest quality of care, but that we're also fiscal stewards of the resources, the precious resources that are given to us. And so part of our quality program is annually we identify goals, not only in quality, but regarding our people and collaboration with our community, growth, resource management, and service access. And this just represents what our aspiration is, that we consistently deliver a 5-star experience, 5-star quality, in a 5-star way. And that it's based on a foundation of a culture of safety, leadership, process improvement, innovation, and then each of those pillars we have consistent quality goals, and we monitor them monthly, and I report them monthly to our board, and they hold us accountable to achieving all of those. And so I think that the remainder of the program here, our physicians, Dr. Rick Selby, and others will be giving you an overview of some of the areas around patient blood management, which is an area that is extremely important, because not only does it reflect services that are seriously and necessary for our community, but also reflects a commitment to quality and ensuring that we are providing the highest quality care.
Thank you, Dr. Hall, very much for being here with us, and hopefully that overview enhanced your understanding of Keck Medicine, what we're doing, who we are, what we do, and we'll talk more, as we said, a bit in more detail about the transfusion-free patient and how Alex and I are navigating that situation.